So now we are going to see about some more vulvovaginal conditions. Here, what do we know about clear cell carcinoma? In clear cell carcinoma, it occurs in those females who have been exposed to diethylstilbestrol when they were in their mother's womb. So when the clear cell carcinoma, so 30 to 40 years earlier, that is those females who are now 30 to 40 years, they will be having clear cell carcinoma of the vagina. So what is the main important reason? 30 to 40 years earlier ago, when they were in their mother's womb and when the mother had used diethylstilbestrol, that is an important risk factor for clear cell carcinoma of the vagina. What is the second one? Second one is a Bartholin gland cyst. So here the Bartholin gland cyst will happen at 4 o'clock and 8 o'clock position. So this is where the typical position of that cyst will be, and it will be extremely painful and tender. What is the treatment? The treatment for Bartholin gland cyst, if it is not infected, then it is sitz bath. But if it is infected, then it is supposed to be incision and drainage. What is the organism that causes Bartholin gland cyst? So this is an important question that you can expect in MLE exams. It is polymicrobial. What about the vaginal foreign body? Vaginal foreign body is obviously going to be a pediatric condition or in adults who have not proper mental status. So it is when there is a foul smelling discharge, then that is associated with vaginal foreign body. Before confirming vaginal foreign body, we need to rule out a physical trauma, and thorough inspection should be done, and we have to look for if there is any abuse marks or if there is any laceration. What do we know about sex abuse? Sex abuse it is a diverse, it can present from starting from pediatric to elderly case. Even though sex abuse presents in many forms, MLE is in particular that to associate laceration with sex abuse. The sex abuse may or may not be associated with discharge. Thank you for listening all this while.